back to my channel, and this is episode 5 of year 1 nursing journey. And today I'm going to be talking to you about my tripartite meetings, and I'll be giving you a personal and honest look at what each tripart meeting meant and taught me, from the first impression to my final sign off and then stepping into second year. So for those of you that don't know what a tripartite meeting is, and that's for the new first year students or possible students going in to do the nursing course, a tripart meeting is a formal check-in between myself, my practice assessor, my academic assessor, and it helps me to keep track of my development across placement and university. And the university that I go to uses something called an EPAD, which is an electronic proficiency pad that you use to get your proficiency signed off from the beginning of the year right through to the end of the year. And at the end point, you need to make sure that you have both your formative sign-offs completed, your summative sign-off completed. You have to do reflective episodes of care, annexes, everything like that needs to be signed off, ready for you to move into second year. And I'll be reflecting on my initial, which is my first meeting, my midpoint, which is a mid-meeting, and obviously your final meeting, which sends you into your second year if you are successful. So firstly, I'm going to talk to you about my initial tripartite, which is your beginning meeting. The way it worked for me in my first year is that I had a meeting with my academic assessor, which was my university link. And I had my practice assessor. Now, like I said in my first video, I never actually met my first year practice assessor because of personal reasons. They just weren't working for that year. So I was given supervisors, and obviously any meetings that I had held was with the ward manager, who was the band 7, and she was absolutely lovely. How did I feel going into my first ever tripartite? Well, I had absolutely no idea what to expect, so I was dead nervous. And you know, when you're doing something new and you just want to make a good impression, you get a little bit of imposter syndrome, like I've said in my previous videos, and that's definitely the case for my first year meetings. So we sat down in the break room, and then we kind of went through the EPAD proficiencies, what I wanted to get out of the first year, what goals I could set, what kind of milestones I could set to meet these goals for, and then we discussed how to set these goals and then made them come to fruition by the end of the final tripartite. So I'd never met my assessor before, so my first impressions were that she was lovely. With her being an academic rep, she was really helpful at putting solutions into things that I had some anxieties about, and how I was going to meet these goals at certain times, and how to just be quite firm when it comes to sign-offs, because some universities use a paper pad and some universities are transitioning to what we use, which is the electronic pad. And how the electronic pad works is you take your supervisor or assessor's email, you send them a link, it goes to your pad, they can sign off your proficiencies. But if anyone that is currently in their nursing degree doing their first year, be that paper or electronic, you know how difficult it can be when you're on a busy ward, trying to like poke and prod your assessor, but oh, I've just sent a quick email, can you have a look at this? And they're like, oh, I'll do it when I get home. And then you spend the next 2 weeks of your life chasing them up. And I don't know about anybody else because I don't know what other courses do, but for us, if our link goes past that 2-week period, that link then expires and you have to send a new link. So it just becomes a real big faff trying to get things done, which can just cause more anxiety, more stress. But I promise you, you learn little tricks at certain points in your year. You kind of know if you're going to get a spoke placement that's a little bit kind of more relaxed, like a 9 to 5. You've got plenty of opportunity to get your pad signed off, and you find sometimes that spoke placements are a lot better to do the proficiencies and look at your EPAD, etc. So once we kind of mapped everything out, I felt like I was put at a lot more ease. I didn't feel as anxious, I didn't feel as nervous. And it was really good to actually formally start developing and mapping out how I was going to get these things done. Having the ward manager there actually was very helpful because she put into place learning milestones for me. So she wanted certain things done by the time that I returned to the hub for my final 6-week assessment period at the end of the year, which was really helpful. And what was really good as well is we could sit there having the ward manager's diary open, and we could set the point for my midpoint. So I'll talk about the midpoint in a minute. So it was really good for that, you know, and I can remember looking at the pad and looking at all these proficiencies that I needed to get done. And it was just really stressful trying to get it sorted. And it kind of put things into perspective at how busy this year was going to be. And I needed to, you know, put a lot of effort into making sure that I got things signed off in a very reasonable time. So moving forward into my midpoint meeting. So this is kind of done in between your middle of the year, really. It's a midpoint meeting. So how it works for us is our initial meeting was done our 2 weeks in our hub placement for our first year. And then it was done, because I'm a September intake, it was done in the April time for my midpoint, and then June time was for my final meeting. So I kind of sat with because I was in a spoke placement at the time, so I had to make sure that I could kind of work around my spoke placement to get my meeting. So I had a meeting, which meant I had to leave my spoke placement, go to the hospital, go to the ward, and then sit with the ward manager for 5, 10, 15 minutes and just discuss, have like a little check in, really. So it's really good because I kind of sit there and I kind of say how things were going throughout, halfway through the year, what new opportunities I'd learned, where my spoke placements were, and just have a general catch up with the ward manager, which was really nice. Um, she kind of discussed where I was in my proficiencies, i.e., because she had access to my pad, so she was able to see what proficiencies I'd had signed, any assessor feedback that I had from my spoke placements, and any annexes that I had signed. Now, I've been quite lucky at my second spoke placement, which was endoscopy, which I spoke about in my second video. So if you haven't seen that, go check that out. And I was with a beautiful nurse who just kind of sat with me every 15 minutes for every shift that I had, and just had a look at my efficiency, see what we could meet, ask me some questions, and she was happy to sign them off. So she'd really helped with that point. So I've met the ward manager's kind of expectations to have things signed off at that specific time. She put in a support plan to help me get some more proficiency signed off, ready for when I came back. So she wanted all of my formative assessments and my annexes to be completed upon my return for my final 6 weeks to work on my summative assessments, which include medication management. You have certain proficiencies that the NMC set out, so your NMC proficiency standards, and then your annexes, which are kind of meet your clinical skills, and they are very fundamental to your year. So as you can imagine, first year is very fundamental, looking at the basics of nursing care and healthcare, and then second year kind of escalates up, looking at more clinical interventions, and obviously third year is your management and looking at how to manage a patient and delegate workloads. So we came up with a support plan, and that really helped. And she said, looking at my reflections, she's happy with those. And I think the more that you're on the course, and for those of you that are first, second, or third years or coming into the course, reflection is something that you'll come across a lot, and you'll get better at it the more you do. A lot of your assignments are based on reflection, and you do a lot of reflective practice as part of the EPAD proficiency for the NMC, as obviously revalidation is a reflective process. Leaving the midpoint, I actually felt a lot more confident in my abilities because she kind of talked me through some things. We went through some scenarios, and we kind of had a really good chat and catch up, and made some plans moving forward, which kind of helped my confidence because I kind of knew that when I returned to my hub that I was going to be straight into my assessment periods, and it would be heavy, but it would be good. So my midpoint was a really good check-in for me, and it kind of helped put everything at ease because I knew that when I went back, that we had a plan in place. It was just whether or not that plan would be kept because wards change, environments change, they get busy, they get not so busy, etc. So my final meeting kind of took place at the end of my 6-week summative assessment period back on the hub to qualify to go into second year. So what I mean by that is your EPAD is split from formative, which is a non kind of formal assessment of your skills, where you'll kind of ask the nurse to sign you off as proficient, and then they'll talk it through with you, and they'll ask you some questions. And sometimes you'll get it where nurses have seen you do that proficiency, and they're like, "I'm absolutely happy with you. That I'll sign that off, not a problem." So this 6-week period was more of a summative assessment, which is a formal assessment of all your proficiencies, your annexes, your episodes of care, etc., etc. And I remember getting to that end point of the first year, and I remember being, which was so nervous. My heart was going pitter patter, and I just couldn't focus on being on the ward. All I had in my head was it was my final meeting. This is make or break. I'm either going to be kept for reassessment, or I'm going to go into second year, move on to my kind of enhanced learning opportunities. So some of the key achievements that I was really proud of going into this meeting was that I'd met all of my summative assessments. I'd been with nurses. I'd worked with them formatively, and I've worked with them summatively, and then I had all my medication management signed off as proficient and safe, which is kind of one of my biggest worries because maths is not my strong point. Even though the dosages and the calculations are quite simple, you just you panic when someone, oh, can you do some medication? You just go into pure panic mode and you can't do simple maths. So I was scared that was going to happen, but it never did. And I was really happy and proud that I'd done that, because I get myself all in a tiz sometimes when I do stuff like that. So my final tripartite, again, I had the ward manager there and my academic assessor. And how it works, we went into the office where it was quieter so we could have a really good formal discussion and go through my EPAD. So what my academic assessor did was she went through my EPAD prior to the meeting. She looked at all my formatives, all of my summatives, all of my annexes, my episodes of care, any feedback that I'd had from supervisors or assessors, my own personal reflections, and there was something else I go through, but I can't remember. Oh, you're to have all of your certifications. So you'll notice you do a lot of e-learning, and you need to upload that e-learning. At least in the university that I go to, you have to upload that e-learning onto your EPAD to show that you've done the training. That makes you proficient to work within the trust that you're working in. And you've also got to upload your manual handling certification, your BLS, which is basic life support, and some other certification that you have to upload. If you don't have any of these, all of these uploaded, then you can't go forward and get signed off in the second year. So it's really important that you have a lot of organisation skills and you keep yourself right and make sure that you have everything. Obviously, we use Blackboard, and I'm sure other universities in the northeast of the country use Blackboard as well. I'm not sure about the rest of the country. And that keeps you right because it gives you a list of what you need before your meeting, which was really good. That kept me in check. So once she's done that, we went into the office and we kind of talked about my EPAD. We had some reflection on how I think my first year went. And actually, what I was really proud of was some of the manager's comments, because I'd worked with her personally and she was very enthusiastic about me as a student nurse. You know, some of the comments that were made is that I was working well above what was expected of a first year student. I was managing patients, doing documentation. I was hands on. I was never afraid for learning opportunity, etc., etc., etc. Some learning points, which I always liked. I like constructive criticism. Was that I should probably try and be a little bit more confident, because I can do things, but I tend to get a little bit kind of unconfident if I don't feel like I'm competent to do that, which I don't think is a bad thing because it keeps me in check and it stops kind of any overconfidence. You will come across some students that can be overconfident and overbearing, and it gets them in trouble because they do things that they shouldn't quite do. So I'm quite proud that I'm able to have restraint and I'm able to keep myself in check. A couple of emotional moments. I think I talked about in a previous video about an end-of-life patient where I followed them from admission to the ward. Fortunately, they were palliative anyway, and palliative is obviously pain management. They had a chronic illness that required chronic pain management, and unfortunately, that became end-of-life care. And a comment was made by the manager that I was very professional and that the family were very grateful for my compassion in dealing with that and giving the patient the choice of how they wanted to kind of aware and how they wanted the end of their life to kind of come to its natural end, which was quite nice. And then obviously it came to getting signed off. And I think when you get signed off and they're happy, it's a very long, dubious process. So you have all your proficiency signed, then your academic assessor says to the ward manager, do you think this student is safe to continue into second year? Yes or no. If it's a no, then you have to go and redo a 4-week reassessment period where you have another final meeting. And then if you don't pass that meeting, then unfortunately you're taken off the course for being unsafe. Luckily, it was a yes. So we move forward. My academic assessor then has to make a decision. Is she happy for me to move forward? So what she looks at alongside all of this is all of your assignment and assessment marks. So, for those of you that will come across hopefully passing everything, and good luck to anyone that has assignments and things. And unfortunately, for those that don't pass the first time, you have a reassessment submission period. So I didn't have any resubmissions, so I could quite happily and confidently move into second year. So she was happy to sign me off. And that final meeting hits you because you realise how far you've come and you've grown as an individual without even realising it. And then hearing my assessor and the manager say that I've developed into a safe student and then signing you off, you just have this wave of just relief. And I can't describe it to you. You have to kind of experience it for yourself, but that relief you get is just amazing, because then you suddenly, like, your shoulders drop, you just relax, and you're just like, oh, I've done it. And I was very lucky that my final tripart meeting landed on my last shift. So for me, it was really nice to kind of have a couple of weeks after that to kind of decompress and let everything kind of come out and relax. And I don't know about anyone else, so please pop in the comments your kind of experiences with your meetings, because it's always really good to hear what other people have experienced, so I know that I'm kind of not on my own on those things. But for like a week after, I just felt really unwell. I think like just like got cold and flu, and I just felt really like bunged up. And I think that's because you get yourself so wound up and then you kind of relax that your immune system just like, oh, and then you end up getting a little bit ill. So I had a really good positive experience for my first year, initial, midpoint, and final. And I was quite lucky that I got signed off to move into second year. So, having talked about my tripartite meetings, I kind of want to look forward. Uh, and your tripartite meetings really help you when you're looking at moving up into either your second or your third year. Obviously, I've mentioned previously that I'm in my second year. Well, I've just finished my second year, moving into my third year. And, those early experiences, having reflected on them, helped me build confidence moving forward. And especially when it came to my first initial midpoint and tripartite meeting for my second year, because I kind of knew what to expect. I knew what I needed to do and I knew how I needed to get there. Obviously, in my second year, the university had decided that they were going to change the curriculum completely. So that meant a whole new timetable, new theory lessons, and obviously practice hours. So, it's kind of a bit of a shake up, and it meant that your midpoint and end point were very close together. So my midpoint was in April and my final was in May. So I had 3 weeks between my midpoint and my end point to get things signed off. So yes, that was a little bit tricky, it was a little bit stressful, but I knew what I needed to do, so I just got my head down and I just cracked on. It's really important as well that you have a good academic assessor for the university, because they can really support you. And you, hopefully, for those of you that are in your first year and are going to be experiencing your first meetings or have experienced your first meetings, hopefully you had a good practice assessor or supervisor that was really approachable and willing to support you throughout this process, because it can be very stressful. So I just want to take this opportunity to thank you very much for watching my videos. And if you haven't seen any of my videos about my nursing journey for my first year, please go back onto the playlist and have a little look through. So my next video idea will be looking at moving from first year to second year, and we'll be looking at the jump. And I'll probably go through the same process of talking to you about my hub placements, my spoke placements, kind of any extended learning opportunities that I have. And like I said, I'm currently coming to the end of my second year. I have my enhanced learning opportunities left to do, and I've been really, really lucky to be part of the international placement to Cambodia. So what I'll try and do is get all the videos kind of up to scratch, talk about everything, and then hopefully when I go to Cambodia I can kind of vlog that experience and put that into a separate video, take you guys along with me. Thank you again for watching my videos, and please pop in the comments. I like to talk to people, so pop things in the comments. If you have any ideas of what you'd like to hear from any of my current first and second years, pop it in. It'd be good video ideas, and I like to interact with people watching my videos. So until next time.